Hi everyone, welcome back to my channel. I have a condition called P.O.T.S or postural orthostatic tachycardia syndrome. If you do not know what that is, please go check out my other video explaining exactly what P.O.T.S is. Now, recently I was asked how often do I go into pre-syncope or pass out, and what do I do in that scenario? Well, why does this happen? Is it an important thing? Well, for a P.O.T.S patient, we pass out because our blood is pooling in our feet, which means you're not getting enough blood or oxygen to the rest of your body. Therefore, your body will send you into pre-syncope or syncope in order to get that blood back to where it needs to be. Now, for me, this is normal. This happens quite often, and I don't need to go seek medical attention every single time it happens. Now, if you do not have a condition that causes you to pass out or go into pre-syncope, please go seek medical attention if something like this were to happen. Because for you, you don't know what's going on. For me, I do. First things first. What should you do? Well, if you start feeling symptoms of you starting to go into pre-syncope, please immediately sit down or lay down. For me, I have to lay down and elevate my feet. If I don't, I will completely go into pre-syncope and syncope, and it will take a whole lot longer for me to recover. So, that being said, please do not remain standing if you are standing, because if you were to fall and hit your head, that would be bad. So please immediately sit down and lay down if possible, because if you do not listen to what your body is trying to tell you, it will force you to the ground. So please do that. Now, at the beginning of my journey with P.O.T.S, I didn't know my symptoms. I didn't know the symptoms leading up into me passing out or going into pre-syncope. I didn't know what to look for. I didn't know how to respond. I didn't know treatments to help prevent it. I didn't know what to do. So it was happening every single day. It was, if not multiple times a day, for a long time. And then I got a diagnosis, and even after the diagnosis, figuring out treatment plans, figuring out what works, takes a while. So for a while there, even with the diagnosis, I was still passing out and still going in pre-syncope every day. Now I'm on medication. I've found the right level of salt and water intake that I need to be on to help prevent it. Now I'm down to at least once a month, if not once a week. And every time I go into pre-syncope, I do increase my salt even more than it already is. If I go out with people, I make sure that they know my condition, they know what happens, they're prepared for that scenario, they know what to do in case of that scenario, and they know my protocol. So my protocol is lay down flat, elevate feet, and take more salt. And I have to do that every single time. I've gone into syncope and passed out sitting. I've done it laying down, and I've done it standing. So I do have to elevate my feet. Laying down does not do it. I do have to completely elevate my feet. Some people sitting down will work. Others laying down flat will work. For me, I have to elevate my feet. But you really do have to pay attention to your body, your symptoms, what your body's trying to tell you to do, and what works best for you. I hope that by you knowing what helps me a little bit more will help you. But by whenever you go out, having everybody that you're going out with know everything regarding your syncope and pre-syncope and protocols will help and be able to take action if you need them to elevate your feet or help you in any way. Another important thing would be have something called a medical ID. Now, these can be in necklaces, bracelets, as long as you have it on you at all times. I have one that goes on my watch band, and you scan the back of this and it gives you all my information. That way, if something were to happen and they were to call ambulance, that they can then take my information and then help best treat me if I was unable to respond. For me, I get really bad brain fog and can't remember anything really. I can't really put together complete sentences whenever my brain fog gets too bad, so I can't remember medications and stuff like that to be able to give them. So having something like that is very helpful. That way it is on you and they know, because if you do have diagnosis or multiple diagnoses, that could change your treatment a bit, and also depending on what medication you're on, that could also affect the treatment. So making sure you have that on you, that way nothing interferes with anything else you're on, and that way they know, okay, she has this, we can do this to help treat it. So making sure people know, making sure you have the medical ID, and making sure you learn your body is the 3 biggest things in learning what needs to be done. This could take a long time. It took me a very long time to figure this out, quite a few months, and it's different day to day. So it's really listening to your body all the time and figuring out what it needs. That's the biggest thing with things like that. I hope this helps, and I hope y'all are all having a great day. And thank you for watching. Bye.